All right, let's get started with chapter 1. So for these videos, I'm going to be doing just highlights of the chapters, not going through everything slide by slide, because many of the topics you actually can just read it off the slide and are fully able to understand it. So I want to focus these on concepts where you have to actually know stuff in more detail, or having a thorough explanation of it will actually be very beneficial. So I'm going to skip through a few of these first few slides. So just kind of real basic information. That's what this chapter is all about, going through just kind of the basic things that you'll need, wrong slide, as a good foundation for anatomy. So this whole first exam section is that. So making sure that you have the basics of chemistry and cell biology and genetics in order to do what is necessary for building of just AP1, but also AP2. So starting with our first topic, comparative physiology. So with the theory of evolution and with more complex beings becoming evolved from lesser ones, we are able to use, for example, animals in order to study human anatomy because their structures are very similar. So for AP1, we will dissect a mink as well as a sheep brain and a cow eyeball. So I do mention those animals just in case for religious regions where you might not be able to use the cow eyeball. We will have sheep alternatives, hopefully, we usually do, for that situation. For AP2, you'll dissect a pig heart as well as a kidney. And we're able to do this because the structures are very similar. So when you're looking at the textbook diagrams and then you're doing the dissections, you actually see that it is in fact very similar. Another thing, if you are a hunter and you have access to a deer heart, deer kidneys also work well. I've never seen anyone do an eyeball, but probably very similar, same thing with the brain. So if you want to do your own, have your own personal at home, it actually would work well. So another reason why we use animals instead is just because they're easier to do, especially when it comes to development of new drugs, new procedures. We're able to have the animals and test on them before we get to the human ones. Okay, so let's look at human structure. So for the structure of any organism, it has some level of complexity. So you start off with something super basic, such as the atom, and then you build up from there. So this is also how our course is going to go. So we're going to do atoms and molecules with our chemistry chapter, organelles and cells for our cell biology chapter and our genetics stuff. Then moving up to tissues, which is chapter 5, and then we'll go into our different organ systems that are eventually going to build up into our organism. So this is a list you need to know for the exam. So starting off the atom, atoms create molecules, molecules create organelles, and then cells, tissues, organs, organ systems, and then the full complete organism. So with our anatomy books, there's certain things that are kind of normal on the different structures, but not everything is the same. One very important one is a condition called situs inversus. Basically, the site of where stuff is inverted or on the wrong side of normal. So it's just a flipped placement of where stuff is. So if I'm looking at this chest here, this is our normal placement of our major organs. Lung, heart, liver's on your right side, stomach is on your left side. Someone with situs inversus, everything is flipped. So in this case, instead of your heart being on the left side of the body, it's now on the right. So for example, if you're getting a defibrillation paddles placed on you, it would actually have a switch position so that you're making sure that you're actually going across the heart muscle so you can stimulate it to contract. Another reason why you want to make sure that your patient, you know where your patient's organs are, and people with situs inversus, they usually wear a medical alert bracelet in that situation so that even if they pass out and your EMT is helping them, that bracelet will tell them, hey, the organs on the different sides. So let's say if someone has a problem with their liver and they're going in for surgery. So for someone with situs inversus, instead of the normal placement of the liver being on the right side of the body, for them, it's on the left side of the body. So knowing where that is, make sure that, hey, if you're having surgery, the person knows where to cut. So other variations in humans, so with our humans, we do have certain values that are consistent. You do have some variations. Of course, you have to, references as you're dealing with levels of medication or whatnot. But there are certain things that we keep in balance, and that is called homeostasis. So we have some kind of stable internal condition. So things that we keep stable: our body temperature, our body's pH, the levels of ions in our bloodstream or in other fluids in our body, our blood sugar. So particularly for diabetics, they have to maintain that. Our blood pressure. So that's goes important. If it's too much blood pressure, you might end up breaking a blood vessel or causing issues with, getting nutrients and waste products from tissues. So in order to keep this balance, we have a situation called negative feedback. So we have a set point. That set point will be your normal body temperature. So 37 degrees Celsius or 98.6 degrees Fahrenheit. So let's say you're outside, it's super hot, like it is right now. Let's say, so your set point's off, it's now too high. Your negative feedback will have some kind of negating action to correct the whatever's too high, or too low. So your negating action is going to shift you back towards that set point and get things back in balance. So if you don't do this, you also could cause some kind of illness or death. So just your body either stops functioning, or if you get too hot or too cold, yes, you can die. So let's go to, okay, so how we know this works. So for those different things like temperature, pH, and whatnot, we do have receptors. Those receptors are going to be stimulated. They send that information into a integrating or control center. That control center is going to make a decision on what the negating action needs to happen in order to get back to that set point and make our body happy again. So the effector would be the correcting action. So let's look at temperature. So here we have 98.6 degrees Fahrenheit or 37 degrees Celsius. That's our normal body temperature. So if, let's say, normally our body temperature does fluctuate, so it doesn't stay at exactly that are 98.6 degrees. But let's say our body temperature is dropping, our body temperature is getting too cold. Ways we can fix that. So our negating action in this case would be vasoconstriction. So this makes the size of our blood vessels smaller. Therefore, when you have blood that's going towards your skin, instead of losing the heat, touchscreen. Instead of losing the heat off your skin and losing it to the environment, those blood vessels will become smaller and therefore less able to lose that heat to the environment, therefore saving it for your body, and then hopefully getting your body temperature back toward the set point. Another negating action would be shivering. So you kind of move your muscles around and you shake a little bit, and it actually helps to warm you up because your muscles aren't completely efficient at using energy. Some of that energy is lost as heat, and that helps to warm your body up. Similar situations we have to cool the body off. So vasodilation. So if you've ever been outside and you get super red because those blood vessels near the surface of your skin open up, become larger, so dilate. When they dilate, that allows for more blood flow to the skin, causing the redness, and therefore you're able to get rid of the excess body heat and cool off. Another negating action is sweating. So with water has a high ability to hold heat. So the wetness on your skin from the sweating would draw heat away from your body and then cool you back down toward your set point. Okay, so that's just the text version of what I just described. Another type of negating feedback dealing with our blood pressure. So if you're lying down and when you stand up, blood drains away from your head. That pressure difference is sensed by receptors in these major blood vessels. They tell the brain, hey, there's not enough blood going towards the head region. The brain, so particularly the brain stem area, is going to make that correction, telling the heart, hey, speed up so that you can get more blood flow to your brain so you don't pass out. Another way we're able to make changes in the body is something called positive feedback. So positive feedback is when you want to continue a change in the body. So the initial thing that sets it off is going to create a change. That change then sets off another change to help continue the cycle of going in the same direction of that change. So for example, you having a fever. That can help to self-amplify your temperature so that you can kill off the virus or bacteria that has invaded your body. Another example of positive feedback would be during labor. So we have the fetus's head, it pushes against the cervix. That receptor there tells the brain, hey, we have this pressure going through in labor. The brain releases a hormone called oxytocin from the pituitary gland. That oxytocin causes the change of the uterus to contract. When that uterus contracts, it pushes the baby head even further on the cervix, and then we continue this path until the baby is fully expelled out of the body. So another thing that we're able to use in the body for just normal function is the use of gradients. So you're going to see this a lot. So as a gradient is a difference in your concentration between two areas, a difference in charge, temperature, or pressure. And we'll actually see this all the way through, even in AP2. So with our gradients, matter, energy, it's always going to go from high to low naturally. So just passive flow is going to go from a high concentration, charge, temperature, or pressure to a lower area. So for example, if I'm looking at the little dude with his wagon, if he's going to go down the gradient, so in this case down the hill, he can just sit in his wagon, let gravity do its job. But if he has to set up his gradient, so get back up to the hill, it actually takes energy. So in order to set up these gradients, we actually need to put work in or put energy in to set up that gradient. So one way we're able to use this is, for example, with our flow of blood. So our heart pumps. Big, strong contraction pushes the blood out of this top one called the aorta, and the blood has a lot of pressure there, and then it goes down its gradient so that it can get all the way down to your tiny little fingertips. Other areas where we use gradients, we have, for example, in digestion, for example, something that we've broken down, so in this case, glucose, which is our blood sugar. It's going to go from a higher concentration in our small intestines into the lower concentration area where we have the cells are, and then eventually into our bloodstream. Same thing with electrical gradients. So we'll talk about charged particles next chapter, but they go down their gradients, and that way that setup gradient actually allows us to do a bunch of different stuff that we'll actually talk about through both AP1 and AP2. We already talked about this one earlier, vasoconstriction versus vasodilation, allowing heat to go from the skin down its gradient to the outside environment to cool off, or to prevent that from happening to keep your body warm. Okay, so here's an example. In this gradient, which way are the particles going to travel? So we have a high concentration here, a lower concentration here. That means those particles are going to naturally go down their gradient toward the lower area. So remember, high to low. So the rest of this chapter is what's called Atlas A. It basically takes the body, breaks it up. So we have different planes of looking at where stuff is located in the body. So we have our normal anatomical position. Even if your patient is lying down, you still reference their body as standing up, feet forward, palms facing forward, and that way you're able to tell the body how, where you're referencing different directions. So you can actually make different cuts, and you can see different things on these different sections. And then there's also different directional terms. So this actually is on your exam. Excuse me. So different terms for something that's more forward or something that's more back, something that is above, superior, or below, inferior, proximal versus distal. So all of these are really good for the bone exam, by the way. So something that is proximal is closer by. Something that is distal is further away. And this one will come so different go. Medial versus lateral. So something that's closer toward midline or the middle is medial versus something that is on the outside or away from midline is lateral. So the rest of these just go in these smaller regions, describing them, different ways to describe your abdomen in just different regions, different body cavities, and those body cavities have different linings that helps to keep your organs essentially contained in the same area. So if something gets infected, it's harder to go to other areas. And then we have our 12 different organ systems, which we'll cover every single one by the time you finish up AP2. So each of these having their different organs that make them up and also their functions. So when I say on the study guide, know the functions and the organs, I want you to focus just on the stuff that's in red. And that is the end of chapter chapter 1. Let me know if you have questions. Escape, there we go. So easiest way just to send a message on D2L, which is our current learning management system, or if it's like the weekend, send it to my email, because I don't usually check D2L on the weekend because I don't get like a message alert on my phone. So if it's something where it's like an emergency where, okay, you got a test Monday, get your question in, use the email, and that way you're more likely to actually get to me. All right, thanks for listening. Where's the stop? Oh, there.